children have problems with using speech sounds, and this can include problems with the muscles used to make sounds. Sometimes there's a muscle weakness with things like cerebral palsy. Difficulties with how messages are sent from the brain to the parts of the mouth used for talking. This is sometimes called dyspraxia. Or trouble with learning and using different sounds to make words. This is known as a phonological difficulty, and we'll look at this group of children a little further. Speech sounds develop gradually during the preschool years and have a set pattern. Most young children will make mistakes with their speech sounds, and this is normal. But sometimes children make errors with sounds that you'd expect them to have mastered. Roughly speaking, by 18 months, parents can understand 25% of what their child's saying, about 50 to 75% by 2 years of age, and 75 to 100% by 3 years of age. A child with phonological difficulties might not use the full range of sounds. They might swap one sound for another, like saying tat instead of cat. They might miss the end off words or have trouble with vowel sounds. They might say dare instead of door. Long or complicated words like banana or helicopter might be tricky too. Children need good sound skills to learn to talk, read and write. If you are concerned about your child's speech sounds, it's better to look for help sooner rather than later. The Ages and Stages film on this website shows which sounds children are usually able to say at which age, so you can use this as a rough guide. A speech and language therapist would be able to assess your child to see if the errors they're making are normal for their age or if they need some help. Most speech and language therapy services have a direct access policy, so you don't need to be referred by your GP or health visitor. The films on this website contain some ideas and tips that are useful for children having trouble with their speech sounds, as well as children who aren't. It's a good idea to find the film for your child's stage of language development and then try some of the tips out. But remember, it's really important to seek professional advice from a speech and language therapist if you do have any concerns.